Hello and good day. This webinar session is the first of the BRAP-PAMET Webinar series brought to you by the BioRisk Association of the Philippines Incorporated, and the Philippine Association of Medical Technologies Incorporated, with the goal of enhancing the capabilities of the laboratorians, especially those working in laboratories handling the SARS-CoV-19 virus, the causative agent of COVID-19 disease. This is the clip of the second speaker, Dr. Viji Vijayan, while the clip of the first speaker, Ms. Maureen Ellis' lecture is presented in another video. Kindly hit the like icon and subscribe button to get access to more training videos. Hit the notification bell too, if you would like to be notified by email of future lectures. Enjoy viewing the video as much as we enjoyed planning and preparing this for you. See you in our next video.
In December 2019, China notified the World Health Organization of several cases of human respiratory illness, a disease later named COVID-19. The virus causing this disease is known as severe acute respiratory syndrome coronavirus 2. The disease spreads through small droplets that are expelled from the nose or mouth when a person with COVID-19 coughs or exhales. Therefore, standing close to someone who is infected can put you at risk. These droplets can land on your hand and be transmitted through something as simple as a handshake, if afterwards you touch your eyes, nose, or mouth, the so-called T-zone. The virus is known to survive on different types of surfaces, so touching these contaminated surfaces and then touching your T-zone brings a high risk of infection. What we know so far: the coronavirus is spherical in shape, and its genetic material is encapsulated by different types of proteins. Some of the key structural ones are spike S protein, the most prominent feature of coronaviruses from where they get their name, then M, or membrane protein, and the so-called envelope protein.
The BioRisk Association of the Philippines, in collaboration with the Philippine Association of Medical Technologists, warmly welcomes all our virtual participants on the international webinar on essential biosafety for COVID-19. The coronavirus disease COVID-19 is an infectious disease caused by a new strain of coronavirus. This new virus and disease were unknown before the outbreak began in Wuhan, China, in December 2019. On 30 January 2020, the Philippine Department of Health reported the first case of COVID-19 in the country with a 38-year-old female Chinese national. On 7 March, the first local transmission of COVID-19 was confirmed. To date, there are more than 5.5 million confirmed cases of COVID-19 globally. In the Philippines, we have more than 15,000 confirmed cases with almost 1,000 fatalities. The laboratory is at the forefront of our collaborative efforts to contain COVID-19. This free webinar is designed to enhance the competency of laboratorians in ensuring the safety and security of their respective workplaces and institutions amid the continuing threat of the COVID-19 pandemic. This webinar will be moderated by the Assistant Auditor of the BioRisk Association of the Philippines, Mr. Larry J. Langaman.
Indeed, biosafety is an integral component of any biocontainment facility, such as laboratory. Today, we are delivering to you a webinar on essential biosafety for COVID-19, and it is my distinct honor to be your moderator. Our second speaker is a prolific biosafety and biosecurity advocate. She began her career in biomedical research laboratory, where she worked for about 10 years, after which she switched to research operations and laboratory safety. She now holds the position of Associate Dean in the Duke National University of Singapore Medical School. In this role, she oversees safety, health and emergency management, procurement, and research operations. She also chairs the school's Safety and Crisis Management Committee, where oversees all aspects of safety and emergency preparedness in the school. Safety science is a passion that she has nurtured in the last 3 decades, especially the integration of safety into daily work life. In addition to safety-related portfolio in Duke-NUS, she also serves in various organizations related to the practice of BioRisk. From 2014 to 2017, she was the president of the BioRisk Association of Singapore, and upon completion of her term, she continued to serve as a member for several years. She is currently a member of the board of directors of the International Federation of Biosafety Association and vice president of Asia Pacific Biosafety Association. She also consults in the field of BioRisk for various organizations like the European Union CBRN Centers of Excellence, World Health Organization through their partner agencies, Global Affairs Canada through their projects in Southeast Asia. She has completed a WSQ Advanced Certificate in Training and Assessment, which specializes in adult training methodologies, and she has a master's degree in Human Factors and Systems Safety from Lund University in Sweden. Her extensive expertise in the field of BioRisk, together with the knowledge she has gained through the master's program, gives her a specific set of skills and abilities that enables her to develop and implement BioRisk management systems with a distinctive approach. Her training style incorporates knowledge that she has gathered over the years, not only in the field of biology, but other industries like aviation, railways, and others. Her motto is that safety is simply how you work. Dear participants, please welcome our second speaker, Associate Professor, Dr. Viji Vijayan.
Hello, everybody. How are you? Mabuhay. And usually I cannot sit still in one place. And the stuff that I really like about the Philippines is all the singing and dancing, but we won't have any of that this time. I need to just make sure I'm heard, right? Somebody can tell me it's okay. You can hear me?
Yes, we can hear you, Dr. Viji.
Perfect, perfect. Okay, now let me share my screen. That's the first thing I have to do. Where is my screen? Okay, and I suppose you can see the screen too now, right?
Yes, Dr. Viji.
Okay, perfect. Thank you very much. So I'm here to talk about risk assessment and control measures. Earlier on, Maureen was talking, and then she told you guys a lot of things about what's the theory behind various things and how you should take care of things. And one of the things she said, and one of the things the person's introducing us said, is it must be risk-based and it must be locally applicable. So that's my passion. Don't just cut and paste from somewhere. Make sure it's applicable in your own setting. So let me start with that. Very simple. What is biosafety? And I hope you will understand. And please also remember at the end of it, you have to do some assessments. So all the answers are here. You must pay attention. And then, so the most important part of biosafety is really to prevent the lab worker from getting infected while performing the work. And this infection, if it occurs in a lab, is called a lab-acquired infection. And then you have to make sure that you handle the infectious agent safely and you contain the infectious agents. So containment is a technical term that people use when they talk about biosafety, because what you're saying is you are not allowing the biological agent to spread all over, either through infecting a person and that person going home or just being released out of the lab, but you're containing the infectious agent. So that phenomenon is called containment. So there's something called biosecurity, and this also the previous speaker Maureen explained about. So what is that? In biosecurity, let me reduce this. In biosecurity, the main objective is to ensure it doesn't fall into the wrong hands. What about the terrorists? What about the baddies? What about all those people? So we have to make sure that it doesn't fall in their hands. And so you have to control the access. And it is not just the material, it is also the data, because if really you think of it, if the genome sequence of a virus is available and there is a scientist who's willing to create this virus for a bad purpose, they can easily do it. In fact, if I just read up a bit, I can create one in my kitchen, because it's not that difficult. You can buy all these material. So the information is also equally important, not just the material. You need to be vigilant about what goes on. Again, there can be insider threat, there can be outsider threat. And insider threat is definitely a problem now, because so many new people are coming in to help you guys and help everybody else to do the diagnosis. Okay, so be attentive. Together, biosafety and biosecurity is called BioRisk. That's all. It's not rocket science. So there is something called BioRisk management system. So there's a BioRisk, and now you have to manage it. What you have to do is, in a systematic way, you enable the labs and the related facilities to achieve the biosafety and biosecurity objective, which is to keep people safe and to make sure that the biological agents are safe and don't get into the wrong hands. It consists of several things: the physical layout of the facility, engineering, that means heating, ventilation, and air conditioning, and how the air flows, and definitely the biosafety cabinet. Biosafety cabinet is the one place where you can safely do your work, and it is a primary barrier between you and the infectious agent. So that is why it is very important to use it carefully and use it correctly, just like what Maureen said. And then there are administrative measures, training. If you let an untrained person in there, no amount of biosafety cabinet or physical layout or anything else can save them. So training is very important. And then there's going to be documentation of processes. I will talk about it in a moment. Then there is personal protective equipment. I also saw some questions about the same thing. Gloves, mask, what should you wear? What should you not wear? How much of it do you have? And where should you use it? So money is not infinite, right? It will dry up sometime, just like now PPE is so difficult to get. So you must make sure you assess where you're going to use it, so you get the most benefit from using the PPE. The two main principles of biorisk management are risk assessment and containment. Containment, I already told you how you contain the biological agent, and then risk assessment, which is the main topic of my talk. So if you look at the biorisk management system and you go to all these internet places and you see there will be CWA something, OSAS, there's a lot of stuff. And in many places in Southeast Asia, when I go there to teach them, they get daunted by it. There's so much to do and so much to understand and so much to implement. Don't do that. Very simply, you have to identify the hazard, you have to do the risk assessment and mitigate. Mitigate means control. Once you assess the risk, you control the risk, and incident reporting. Pretty much these are the key things in any biorisk management system. You can start with having this, and if you want to later on, you can add all the more beautiful and fluff stuff inside there, but this is the key. So what is hazard identification? Hazards are present in everything we do. When we collect a specimen, when we transport a specimen, when we open the tubes, when we perform the work. It can be biological. In our labs, we know we use chemical. There's also physical. You can trip and fall. It can be electrical and various things. So when you are assessing the biological risk, don't forget about the other risk like chemical, physical, and other risks that are also present in a lab. Let me explain to you. It's usually easier for you all to understand if I explain with an example that each and every one of you do every day. Cross the road. See these two people, they are being good. They're looking left and right and then crossing carefully. Like if I go to Philippines, I never know which way to look because you guys drive on the other side of the road as me. So maybe you'll have the same problem when you come here. And then there's another crossing the road. How many of you have done this? I myself am guilty of it. And this one, if you went to India, there's no way you can cross the road if you look right and left. You'll just be waiting there forever. So you have to learn how to cross the road. So what is the thing I'm going to tell you? There is a hazard, but there is a benefit. What is the benefit? To reach the other side of the road. Maybe you have a meeting. Maybe you're meeting your girlfriend. Maybe you have to do it. So there is a benefit. Every risk that you take will have a benefit, and they have to be taken into account together. So these are hazards, right? Let's look at air travel. I love to give examples of air travel because in my master's program, there were many pilots. And when you listen to everything the pilots do, you feel like never flying again. I wish I could take a train or walk everywhere. So you look at this, the number of deaths is very, very low by kilometer, by hours, and compared to all the other people by hours. See, this may billion hours, but the number of death is very low. So what I'm trying to say is air travel is safer than many other types of travel, yet is the risk zero. The risk is never zero. If anybody tells you the risk is zero, tell them to come and talk to me. It's never zero. What we are doing is we are reducing it to an acceptable level in such a way that the benefit is worth taking the risk. So you always take this weighing scale, you put benefit on one side, you do risk on one side. It's like getting married, it's like having kids, it's the same thing, right? Everywhere. And you constantly weigh the benefits and the risk. And then you decide what is the acceptable risk. And then you proceed to take that risk. Every day we do this in our minds. We are doing this every day in our minds. Maybe we don't write it down and let somebody come and audit you, but you do it. So at work, we cannot do it in our minds. We have to document it because somebody is paying us a salary and we have an employer and there'll be auditors and there'll be lots of questions. So you will have to write all this down and document it. One of the reasons why you document is so that everybody follows the same exactly. So this everybody following the same is not only for safety, but it is definitely also for actually providing the diagnosis. Safety by itself is not, if you have only safety and nothing else, it is a waste of money, waste of effort, and waste of everything else. There must be productivity. So when you take safety into account, you also have to take productivity into account. So if you are making a diagnosis and you tell somebody you must incubate this for 2 minutes, and then this person by word of mouth tells everybody else 2 minutes, but it just changes, and then somebody else incubates for 4 minutes. The diagnosis you give is going to be all wrong. Then what's the point in being safe if you cannot give the correct diagnosis? So remember, you're documenting not only to be safe, but also to ensure that your productivity, your diagnosis, your research results, or whatever it is that you're doing is also correct. And that is why we have to make sure that we document. It can be used for training, and it can be also used for audits and performance monitoring to see how you perform. Did you provide the correct diagnosis? Did you do the work correctly? Did you calibrate your machines? So you have to document all these things for these reasons in the workplace. How do you document them? You can't just scribble in a piece of paper, right? Nobody will understand what you wrote. So you have to write something called a standard operating procedure. The standard operating procedure will be all the work that you do. Please don't write long documents because nobody reads it. Write precise, what is important, what is necessary. Do not cut and paste from somewhere else. Make sure that it is what you can do. My motto, write what you do and do what you write. Because otherwise you'll be copying and pasting from somewhere else without understanding anything that you're doing. And then the document and what you do will be completely disconnected. That's no use. Then you may as well not have an SOP. And so can you have the SOP just in your head and not written down? In many of the regions that I go to train, they don't have it. They don't have any written documents. And then they said they have it in their head because they've done it for so long. But what if the manufacturer had made a change? What if something had changed? How are they going to know this information? What if they say, make a mistake and say the wrong thing? So you must write it down. It must be consistent. The diagnosis for COVID, if you all are giving wrong diagnosis, being safe doesn't make any sense. So safety must always be taken into account with the productivity. So that accuracy of the results is as important as your safety. I'm not saying your safety is not important, but I'm saying that both of them are important and they should work hand in hand. So the SOP of an activity like diagnosis for COVID-19, that's where I like to make the starting point for hazard identification, risk assessment, and mitigation. Because how do you identify the hazard and do the risk assessment and do the mitigation? You do it based on the work that you do. So if you're walking down the street, then that's the work. But if you're doing diagnosis for COVID-19, then that's the work. So that can be the starting point to identify the hazard, assess the risk, and do the mitigation. Hazards are present everywhere, right? Does every hazard pose a risk? Unfortunately, if I was in the classroom, I would have pointed to one of you and said, give me an answer, but COVID does not make that easy for me. I'm very sad. I'm not there, right there with you in the Philippines. But let me explain in the best possible way through Zoom. This is a PowerPoint. We all know this. There can be nobody in this audience of 1,000 people who don't know what this is. Every day, in Singapore, there is 230 volts. I think in some other countries, there'll be 110 volts. There will be 13 amps or something like this. It's inside there. That will be a risk if you put your finger inside there and your feet is on the ground, so the current can pass through you and then it could kill you, or you can get a really bad jolt. But otherwise, it is a hazard. It's the same hazard every day, but it does not pose a risk, because as an adult, you are not going to stick your finger inside there. I hope you're not going to, yeah? If you have been doing it, stop doing it now. But what if you have a small child? Now suddenly that hazard has become a risk, which it was not before. And then what you can do is put all these measures to mitigate the risk. So this is the difference between a hazard, a risk, and mitigation of risk. I hope that is clear. Okay, I'll move on. This is something called risk assessment, and we do a 5x5 matrix. Some of you may have known. So on one side, we have likelihood. That means how likely is this to happen? So with a little 2-year-old child, putting their finger inside the power socket is almost certain, unless it's a very obedient child. But if without any children in the house, is probably rare, okay? And what is the consequence? Consequence means the ill effect, the ill health, the injury. Is it very small? No big deal? Is it minor? Is it moderate? Is it major? Is it catastrophic, like this COVID-19? So this is how you do a 5x5 matrix risk assessment, because it's 1 to 5. And all the green stuff is low risk. The orange is medium risk, and the red is high risk. In Singapore, if any activity at work is deemed to be at high risk, you have to mitigate it down to medium or low before work is allowed. And this risk assessment you do after you put in the mitigating measures, not before, so that you can give a more realistic answer. For example, you're wearing a certain PPE or doing certain things, catching the coronavirus is very low. So you shouldn't put it high, because you are wearing the PPE and you are being trained and you're probably working inside a biosafety cabinet. Okay, then we have to assess what is the consequence. I told you consequence is the ill health. If it's insignificant, means almost no injuries or financial loss. If it's minor, maybe you just need first aid treatment. If it's moderate, then maybe you have to go and see the doctor. If it's major, then it's extensive injuries, loss of production capability, offsite release, and things like that. So with no detrimental effect, that means it's not affecting the rest of the world. It's catastrophic if there's death, toxic release offsite with detrimental effect, and huge financial loss. Okay? Then we have to also have likelihood. Then, so you will say, if it rarely occurs, it's exceptional. Unlikely, then it could occur at some times. Possible, then it might occur at some times. This is a play of words, but don't worry, I will explain how to do this. Likely means most probably occur. Almost certain is expected to occur. So being hit by a car is probably possible. When you're walking while talking on the phone, it's probably possible, but probably not this too, because the car driver also doesn't want you to hit anybody, so he's also careful. Okay, so you can put the numbers 1 to 5 in this way. So let me look at this matrix risk assessment. The matrix risk assessment is a qualitative risk assessment, because there's numbers 1 to 5. It's not quantitative. Quantitative risk assessment means you get actual numbers. For example, in histology labs, they use paraformaldehyde. What is the amount of paraformaldehyde that can be in the air, parts per million? You actually have to calculate it, because above a certain parts per million, it is not good for the health of the people. So that is quantitative. This risk assessment matrix is still qualitative. The advantage is it's easy to perform and doesn't need much special training. There is definite disadvantages. One is it's subjective. I may say 4, you may say 3, somebody else may say something else. If you don't have a big problem between 1 and 5, I think is good. Some people say 4 and some people say 5. Whenever auditors come, they will tell me, oh, this one should have been a 5. Then the next auditor will come, this one should have been a 4. And now I kept a record of all that and show it to the auditors every time they come. Between 4 and 5, it's okay. It's not such a big deal. But 1 and 5, there's a big deal. It's based on past knowledge, right? How often does it occur is based on past knowledge. So these are the disadvantages. Who should perform the risk assessment? It cannot be some manager or senior manager sitting there and writing this risk assessment and giving it to you, say, here, this is what you need to do. No, the workers have to be involved. The people actually doing the work have to be involved in this, okay? Don't cut and paste. And it should be based on the local situation. How's your lab built? Is there a staircase? Is there a corridor? Is there a lock? All these things will play into how you do the risk assessment. So it has to be done for your particular site by the people who are working inside there. In COVID, I'm going to now give you some examples of things. And okay, I'm going to end the slideshow for a moment, because I'm going to give you some examples of things, right? Okay, so this is a risk assessment, and can you all still see it?
Yes, Dr.
I think
Viji.
you can still see it. Okay, so this is how we do the 5x5 matrix risk assessment. So you can go by material, you can go by equipment, and you can go by the activity. This is one method that we use, and if you like it, you can use this. So if you are using SARS coronavirus 2, there's a biological hazard. And there's also cross-contamination, because what happened in the previous SARS in Singapore, there was a lab-acquired infection in one lab. And the way it happened was because this person didn't realize that live SARS coronavirus had actually contaminated what he thought was inactivated. So contamination is definitely a problem, and you have to be careful. So I told you there's something called lab-acquired infection. You can get that. So how do you control? BSC will be used. I'll talk about that later. PPE will consist of these things. There is a waste management program. After you have done everything, after you have taken the swabs, after you have done your RNA extraction and all those things, you can't just throw the swab. You must have a way to manage the waste. Staff training. Staff training, as Maureen pointed out in the new WHO manual, human factors and training is given very, very much importance compared to before. And you can even say the senior staff will handle samples that have the higher potential to infect, and the junior staff will handle other things when it is not infectious. It's up to you. All this is up to you. These are just examples. So again, if you have a lot of ethanol, there's a fire hazard, so you must keep it in a proper place. So I'm going to talk about the gene expert. So I just put it here. Is there a problem in this? Is there a physical injury? Is there electric shock? These are all up to you to decide based on what you do. If you're using a biosafety cabinet, what happens if there's a malfunction? There will be an alarm, but what do? Do the people know what to do? Is it written somewhere? Have they been trained? These are very, very critical. Accidents happen when you least expect it, and a lot of things line up, and then you will have accidents. That's the problem with accidents, and you really don't know when they will happen. Okay, so this is an example that I took from the internet for an SOP. Now, this is the gene expert SOP, what they have given, the insert. There's a lot of stuff. You keep the SOP simple, otherwise people will not read it and it will not be much use. So they're explaining how to do the nasal swab and the throat swab. The way I teach people is the SOP is your starting point, because that is the activity you're going to do. I like them to put a sticker in a place where there is a hazard. Now you all sit together, say, okay, these are the hazardous areas where there's a risk of lab infection. And I will put in here a sticker so that the people who are looking at it will know that this sticker means there's a risk there. So I put it in various places, and you should look at it and put it over here. Maybe there's one here. And you do the risk assessment for those places in which you put the sticker, okay? Now, even this risk assessment, I am a very big fan of not over documenting. In Singapore, we over document a lot of things because we think the more documents we have, the safer we are. We are wrong. Whoever says that, you are wrong. It must be the correct amount, enough to convey the message, enough to be a source of information that the people can go to when they need. If you write volumes and volumes, people who have to provide diagnosis for 100 patients a day are not going to be able to read that. And the final purpose of this is to keep the people safe. I wanted to say something about bench aids. In one of the countries that I visited, they had a lot of bench aids. These are small half-page laminated things that they stick at the lag bench so that they can have a quick look to see what it is that they must be watching out for. Okay, so you can also have bench aids, it's okay, but it's good to be documented and perhaps numbered. So again, I'm going to talk about this BRMO position, so I won't go into my slide presentation first. Okay, so this is what Ian and Martin and they all sent me. Now what happens is that the WHO says that if you use the gene expert, you can do it in certain ways. So these are what they are suggesting. Perform on a diaper. Maureen also said that. Why diaper? If there's a spill, you can throw it away. The under part of the diaper is plastic, so it won't soak through and contaminate more surface. You must wear PPE, the correct PPE, including covering the wrist, right? You must use a risk assessment. You must do that, and you must see what is a respiratory protection. There are many countries in which I have gone, they use N95, but they have never heard of a fit test. There is no much use wearing an N95 if you cannot do the fit test. But there are even videos in which how you can try, you can see if you can, on the top of your nose, whether the air comes out, you must be able to do something. Well-trained staff in good microbiological practice. No rush. Can you see this part? No rush or increased pressure. So if you rush, definitely an accident is more possible. So they have put all these things and they have put guidelines here. This is a BRMO document that the guidelines say for gene expert, you can perform below BSL2, but BMRO has a position, and I'm going to come to that. Now, why do they say that? Why don't they say, no, we don't agree. You must do it in a BSc. You must do it here. You must do it there. Because you look at the benefit. What is the benefit? We are in a pandemic. You have to be able to ramp up your diagnosis. If you put these conditions, then you may not be able to ramp up the diagnosis. And this gene expert itself is done in such a way that there are cartridges and you don't have so much contact with the actual sample. That is a reason why they allow this. Risk-benefit ratio is the key to making sure that there is benefit. If on the other hand, there was no benefit, there was no pandemic, you're only providing 2 diagnoses, then you don't take that risk. That is very, very important. Okay. So here, there's one statement that BRMO has. They've written it here, right? So you see, let me just go here. Sorry about that. So BRMO recommends that it should be done in a laboratory facility with biosafety class 2 cabinet and a dedicated area for doffing and donning. So they say this, WHO says something else. Now you work with your local authorities and see what is your local risk assessment. That is the key here, okay? You must have your own local risk assessment. I put it here because you can look at various guidelines, and if I can send you the slides and you can look at those later. So I'm going to quickly go back. I think I have a few more minutes. So in COVID, what do you think are the SOPs? This is what I came up with, but you may not agree with me. So you must come up with this. Sample collection. That is where the hazard is highest, right? The risk is highest. Transportation, diagnosis. You must have something for training to make sure that they are trained and competent. Simply attending the training, ticking yes or no, or doing the multiple choice questions don't mean anything if you're not competent at the workstation. Waste management has to be managed, and incident reporting. Let me explain what incident reporting means. Incident means it is a work-related event, but it can be a leisure or home-related event too, but we are only responsible for work, people who come to work right now. It is in which an injury or ill health has occurred or could have occurred. A fatality also could have or has occurred. If it has occurred, then it becomes an accident. If it could have occurred, it is a near miss. Now, a silent system is not a safe system. People should be able to report near misses. People should be able to learn about the near misses so that they do not become an accident. There must be no reprisal. And this kind of system in safety science is called just culture, J-U-S-T. That means you're being just, you're being not judgmental, and there's no reprisal. The more of these things you talk about, you will be able to prevent it so that it does not actually become an accident. I'll leave you with one thought. This is how I work with safety. Safety is simply the way we work. Don't think that safety is a separate SOP and work is a separate SOP. It's all together. You have to incorporate safety into your work, because if there is no productivity, being safe is totally no use to anybody else. Thank you very, very much for listening, and I hope you listened and didn't go off to sleep.
Thank you, Dr. Viji, for concretizing the initially mentioned risk-based approach by providing specific and clear examples of risk assessment that we can confidently use as basis of our decisions and actions in trying to protect and preserve the life of our colleague and that of the general public. And we'll now proceed to synthesis. As for the lecture of Dr. Viji, she discussed the risk assessment process in identifying highly infectious characteristics of SARS-CoV-2 virus. Her lecture helped us, the laboratorians, in assessment of risk and application of work restrictions with potential exposure to the virus. The information identified by this process provides a clear guide for the selection of appropriate laboratories' biological safety levels in order to minimize the risk of exposure. This lecture enabled the participants' capabilities and confidence for conducting biological risk assessment and inculcate the importance of biological risk assessment for sound biological risk management. She showed us the matrix of how to do risk assessment, and hopefully everyone got it. She showed us that training is a must for all of us working in the laboratory. We would like to thank our participants who joined us tonight and for being enthusiastic with your continuing education, even in this time of pandemic. Of course, we are grateful for the essential information shared by our two equally important resource persons and personalities of biosafety and biosecurity. Also, we will not forget to mention the significant contributions of people behind the scene. Professor Oliver Shane Dumawal, who is in charge of the technical control panel and post-webinar activities, to Dr. Laila Florento, who is currently halfway across the globe, but is significantly connected just to make this webinar possible. Finally, to the two pillars of their respective association, Dr. Martin Moreno and Mr. Ronnie Puno, we can't thank you enough for your unending vision of providing education and information to your membership wherever they are. This has been Larry, and together with BRAP, we say, stay safe, stay biosafe. Good night, everyone, and good luck on your post-test.
Thank you for viewing this video. At this point we will splice the clip and continue with the first speaker, Ms. Maureen Ellis, in another video clip. Again, from the BioRisk Association of the Philippines Incorporated and the Philippine Association of Medical Technologies Incorporated. We hope you enjoyed this lecture as much as we did enjoy preparing it for you. Kindly hit the like icon and subscribe button to get access to more training videos. Hit the notification bell too if you would like to be notified by email of our future lectures. See you in our next video.